Welcome to this fourth part of the special on psychotropic drugs, dependence, and the chronicity of suffering. In the first part, we discussed medicalization, symptoms, biological conflict, and emotional suffering. In the second part, we developed the therapeutic foundation. In the third part, I began exploring therapeutic strategies, and today we continue with these, moving on to the ancient and wise traditional Chinese medicine. Today we will see how FARO integrates nursing, traditional Chinese medicine, clinical coaching, and humanized therapeutic planning. FARO integration with traditional Chinese medicine. FARO integrative nursing. Within the FARO integral method, traditional Chinese medicine is integrated as a complementary medicine focused on the overall balance of the human being. The FARO integrative nurse works not only with Western biomedical protocols but also with an energetic, emotional, and existential understanding of suffering. Through an expanded clinical interview, the following are evaluated: physical symptoms, emotional history, habits, sleep, diet, stress, relationships, the state of shun, spirit, energy depletion, emotional blocks, and the level of existential suffering. From there, an individualized and progressive therapeutic plan is designed. Depending on the country's legal framework, professional competencies, and accredited training, FARO integrative nursing may incorporate Chinese diet therapy, herbal medicine, habit regulation, breathing exercises, sleep hygiene, auriculotherapy, acupressure, acupuncture, therapeutic relaxation, meditation and mindfulness, and nervous system regulation strategies. The integration of Qigong and Tai Chi into clinical nursing practice represents a valuable holistic approach. These disciplines provide low-impact tools based on breathing and movement meditation, optimizing self-care for nursing staff, and improving the clinical approach to patients. From an integrative perspective, these practices are useful for treating psychological conditions because they effectively reduce levels of stress, anxiety, and depression. They promote sleep quality and enhance restorative rest. They foster the mind-body connection, increasing the patient's self-awareness and resilience. The goal is not to replace scientific medicine or psychiatry, but to expand the possibilities of humanized and comprehensive care. Human beings can endure a lot of suffering, but not the feeling that their pain is meaningless, and this must be recognized, accepted, and given new meaning with the guidance of the FARO professional. FARO coach, facilitator, or companion. The FARO coach primarily works on emotional awareness, motivation for change, behavioral regulation, habits, personal narrative, identity, active listening, existential support, and the development of internal resources. Here, coaching is not used as empty rhetoric of positivity or magical thinking, but as a structured tool for human and motivational support. Clinical motivational interviewing may be applied in each session to reduce resistance, strengthen therapeutic commitment, maintain adherence to the process, foster progressive responsibility, and support real changes in daily life. Motivation is not imposed. It is built therapeutically. Human care is also a form of transformation. Both coaching and nursing staff incorporate the Chinese biological clock into care because it provides a holistic framework for aligning the patient's circadian rhythms with the flow of vital energy. This allows for the design of highly personalized care plans, optimizing the natural periods of peak activity and rest. It serves the following purposes: natural synchronization, circadian rhythms, optimization of detoxification during rest, improved therapeutic adherence. By integrating these cycles, the patient actively participates in their recovery through small daily routines. Therapeutic planning and clinical records. FARO emphasizes a fundamental aspect that many alternative and holistic practices neglect: clinical and legal responsibility. All serious care requires records, clinical notes, follow-up, therapeutic progress, intervention goals, informed consent, and documentation in accordance with the country's health legislation. Because humanizing care does not mean improvising. Ethics also implies professional responsibility, clear boundaries, client protection, and clinical traceability of the therapeutic process. In each session, clinical motivational interviewing should be used to reduce resistance and maintain the client's realistic and progressive therapeutic commitment. FARO learning. True care begins when science stops focusing solely on diseases and returns to focusing on human beings. Understanding the human being requires much more than diagnosing them. True healing begins when the other ceases to be a case and becomes a being in encounter. When knowledge is combined with awareness, ethics, and compassion, health ceases to be merely treatment and also becomes human accompaniment. The good caregiver does not only treat the disease, they protect the balance of life. FARO quote. As Emmanuel Levinas said, the suffering of others is also an ethical responsibility. Technology can alleviate symptoms, but only humanity can alleviate abandonment. Subscribe to the channel. Don't forget to like this video. My kitten and I need to eat. Comment where you're watching from, if you're a healthcare professional, and tell me if you'd like to train as a FARO coach. Share this video to help raise collective awareness. Study with ESSI, Integral FARO Method. Affordable prices and 100% online. Learn science with awareness. Because in healthcare, knowledge isn't neutral, it's vital. If you like this content, see you in part 5 with integrative articulation of FARO and traditional nursing.